Now, with respect to the skin assessment sheets that are in the record, are they required to be filled out with any sort of frequency? Can you tell us? They are filled out every week, or if there is a change, it could be more often. So assuming no change, we can expect one every week for a patient at risk, is that right? And if there were changes, they would be filled out more frequently? Yes. Is that correct? Yes. By the way, on March 2nd, I would have to add something to that. Go right ahead. If a patient is admitted in the middle of the week, but we do our skin assessment, for example, every Wednesday afternoon, another one would automatically be filled out on Wednesday to get them in on the proper weekly protocol. In other words, if I understand your answer correctly, for every week that the patient is in the hospital, and it may not be a full week through Monday week, for every week beginning such and such a date, if he is admitted during the course of that week, you want to have at least one for that week for continuity purposes? Right. According to the skin assessment sheet you reviewed on the 24th, how did you describe the appearance of the pressure ulcer? She described it as a stage 2, as I recall. But on here, did she write 2x2 skin break? No, I can't see it exactly. She wrote it by 2 centimeters. Would you look at the one on the chair? Yes, I'm looking at the chart. She wrote 2x2 centimeter skin break, stage 2, automatically? Yes, she did, which means a skin break, don't forget. Could it also mean a blister? Yes. When you wrote down 2x2, did you understand that to mean a 2x2 stage 2 skin break on the patient's right heel? Yes, that was my understanding. You wrote that out on the week of the 24th, correct, on your skin record? Yes. Did you make any subsequent notation on March 31st? Yes, I did. Would that have been based on your receipt and review of Doug's skin assessment record? Yes, I would say so. Did you make another notation with regard to the right heel on the week of March 31st? Defendant's counsel, objection, putting words in the mouth of the witness, the court overruled. Yes, I did. And you wrote that down as Roman numeral 2? Right. Still a stage 2? Correct. What about size from 2 by 2 centimeters to 3 by 4 centimeters? Referring to the same pressure ulcer? Yes. So that what you noted on March 24th, a 2 by 2 was now on March 31st, a 3 by 4? Correct. 3 by 4 indicating a larger area, which would not be unusual with a swollen leg. Larger area, yes. I will ask you less questions if you just listen to the one I ask, okay? I promise. Did you also note the absence of or presence of an additional wound? Yes, I did. On the patient's sacral area? Correct. And that one we are not going to have any argument about because you wrote HA, hospital acquired, correct? Yes, I did. You indicated stage 2? Yes. You have 2 sets of measurements. Would that refer to 2 sacral wounds? Yes, 2 openings. Chris Duggan says that. And again, at least in the first instance, there is Duggan's record that would be the one you would review. That's correct. Now, I asked you about the treatment record, the nursing care plan, I should say. You indicated to me that there were no entries made on this record with regard to that portion pertaining to potential for skin breakdown due to decreased movement, correct? On this record, yes. And you alluded to the fact that there are other records besides this record? Yes. And I asked you about the admitting progress note by Nurse Will, and we didn't see any specific reference to initiation of a skin prevention plan in the progress note, correct? Correct. In a patient at risk like Frank Manor, the goal of the nurse in the first instance is to prevent precious sores if none exist. Defendant's counsel, objection. The court, sustained as to form. In a patient like Frank who is at risk, do we try to prevent the formation of a decubitus ulcer? Yes, we do. And in a patient like Frank Manor who is at risk, withdrawn, do the protocols talk about guidelines that the nurse can follow with regard to prevention of decubitus ulcers? Yes, they do. How's that?
Basically fine.